We're now going to talk about the differences between lower urinary tract symptoms, benign prostatic enlargement, and prostate cancer. Benign prostatic enlargement and prostate cancer are both common diseases that affect the elderly male. There are, however, significant differences between these two diseases. In benign prostatic enlargement, it's quite common to have lower urinary tract symptoms to some degree, whereas in prostate cancer, the most common thing is to not have any symptoms at all. Another way to differentiate between benign prostatic enlargement and prostate cancer may be through a blood test called the PSA, where an increased level might signify an underlying prostate cancer, but may also be due to an enlarged prostate, an underlying urinary tract infection, or an inflammation of the prostate gland. It is important for the general practitioner to perform a digital rectal examination to find if there are any abnormal lumps in the prostate, which might signify a prostate cancer. If such a finding is made, it is important for the patient to be referred to a specialist urology clinic for further investigation. Having excluded clinically significant prostate cancer, the focus is now on the treatment of benign prostatic enlargement and its effect on that patient and his urinary system. There are a number of treatment options available, for example, lifestyle advice, medications, surgical therapies, and catheters. If a patient has been affected by a complication to his prostate enlargement, for example, a urinary retention, it is important to relieve the bladder from urine using catheters. And the best way of doing this is through clean intermittent self-catheterization, which is the method of choice in suitable candidates. Other ways of treating symptoms is by using medications, for example, alpha blockers or 5-alpha reductase inhibitors. It is important, however, to note that these medications may only relieve symptoms and do not affect the underlying pathology, which is the obstruction of the urinary tract. The only way of relieving the obstruction is through a surgical method. For example, using transurethral resection of the prostate, one of the most common operations that are performed at urology clinics worldwide. There are also other surgical options, for example, open prostatectomy, microwave thermotherapy, transurethral incision of the prostate, or using lasers or water steam. All have the aim of relieving the obstruction that the prostatic enlargement creates, and in such a way enabling a better voiding. Be aware of what methods are most cost-effective. If a patient suffers from mild to moderate symptoms, previous studies have shown that lifestyle advice and medications are the preferred method, whereas if a patient from the start suffers from severe symptoms, the best and most cost-effective approach is to offer that patient a surgical therapy.